Community Connection is sponsored by UK Healthcare.
Important stuff here. We're joined by Dr. Joesph Kim, the Chief of Surgical Oncology at the UK Markey Cancer Center. And we're talking about Liver Cancer Awareness Month. So I think first, tell us what liver cancer is.
Sure. I think it's important for our patients and our communities to know that there are two types of liver cancer. The first being primary liver cancer, cancers that originate in the liver, and the secondary liver cancers, cancers such as colon cancer that spread to the liver. Although those are more common than the primary liver cancers, this is Liver Cancer Awareness Month, and we are talking mostly about those cancers that originate or begin in the liver.
What about risk factors? What sort of things should people be aware of and on the lookout for themselves?
I think there are important risk factors, and I think the most important risk factor worldwide is hepatitis infections. And so we can prevent or decrease our risk for liver cancers by getting vaccinated for hepatitis B. And people should know that we have cures now for hepatitis C. Other important risk factors include heavy drinking, and so people who have history of heavy drinking, they can develop cirrhosis of the liver, which is one of the major risk factors for liver cancer. And also very important for our Commonwealth of Kentucky is obesity. And so obesity is one of the major risk factors for development of non-alcoholic fatty liver disease, and that is a major risk factor for the development of liver cancers. And so patients or our citizens of Kentucky watching their weight and being careful and drinking alcohol in moderation.
And unfortunately, it does still happen. So what are the symptoms?
Unfortunately, the symptoms of liver cancer can be quite difficult to diagnose. I've had patients that have developed extremely large liver cancers without ever knowing it. And so if you notice something that's different about the way that you feel, different about something about your body, and something that just doesn't go away and persists, it's important for you to notify your family doctor and get examined.
And in what sort of ways does the UK Markey Cancer Center stand out in terms of treatment for liver cancer?
The treatments for liver cancer can be quite complicated. One of the most important treatments that we have available is liver transplantation. Other treatment modalities include surgery, medical therapies. There have been major advancements in medical therapies for liver cancer, and we have those available at UK.
And quickly, the vaccine you talked about, how often does one have to get that? Is it a one-time thing, or how often?
So hepatitis B vaccinations, they're required for anybody in the medical field. I believe they're still required for many of the schools that kids attend.
Interesting. Very important information. Thank you, doctor, for being in.
Thank you.
We'll be right back.